Alright, so we're quickly trying to look at another surgery which is done for women that are pregnant. So this is what is known as an episiotomy. Alright, so take note of this. This is someone's anus. This is actually the vagina. So if I'm doing of course I couldn't bring a picture showing naked women because YouTube won't actually know that I'm trying to teach a medical stuff, but they might just term it nudity, right? And the channel might get banned. That's why I just got pictures that are showing at least just a little of it, you know. So episiotomy is if the baby's head comes here so that I can give birth to the baby, and the space in your vagina is not enough, they might just want to cut, like they just cut like a slight part just to increase the space so that the baby can come out, then they sew it back. So this is kind of like better than cesarean section, you know, but there are some times where they do it, there are some times where they just have to go for the cesarean section. So episiotomy, you said that is a surgical incision. It's made in the perineum. That's the area around the vagina and the anus, just like I've explained. All right, so I might just want to cut like this, I might just want to cut like this, just to increase the space so that the head of the baby can come out. Once the head comes out, the body comes out, you know. So this is during the second stage of labor. So you are doing this because you want to enlarge how open the vagina is. So this usually assists, right, with childbirth. So why it might be done, why ones retain episiotomies are now reserved for specific situations. It's not always, all right. If there's fetal distress, right, so if the baby's heart rate is going down, so the baby needs to be delivered so fast, there's no time to be doing some crazy push, you go in for this. Instrumental delivery. So if you want to put forceps or vacuum, so you want to provide space for the forceps and also the head of the baby, you have to increase it, you know. Shoulder dystocia. So the baby's shoulder gets stuck between the pelvic bone. You have to now open up. If the baby is so large or the mother has pushed for a very long time, she's exhausted, you have to just go in for this. So types of episiotomy can have the midline, you know, have the mediolateral. All right, so midline is a vertical cut straight down from the vaginal opening. All right, easy to repair but high risk. You can extend into the anal area, which is not nice. Okay, this is what midline, right? Lateral is just away from it, you know. So mediolateral is a diagonal cut at different angles. It's less likely to extend into the anus, but it's more painful and harder to repair, you understand. So anything coming this way is lateral, right? Midline is down. Okay, so procedure and repair is usually performed under local anesthesia or with an epidural anesthesia already in place. So the incision is made when the baby's head is crowning, almost coming out, right? So after delivery, the cut is now stitched with sutures that can dissolve, you know. Recovery may involve soreness or discomfort, pain during urination or bowel movement, risks of infection, so the wound should be properly taken care of. Okay, so episiotomy and natural tearing, so that's just by the way. Okay, so that's just it for the episiotomy surgery.